Coaches, today we're going to go over the bare minimum hip assessment that you should have for your athletes when they have hip, knee, low back, ankle discomfort, and even shoulder discomfort. So as coaches, we know that not everybody on our team is the same size. So that means people shouldn't have the same foot placement whenever we're doing a squat and or a deadlift or a pull from the floor for a clean or a snatch. This hip exam is going to give you a window into what position your athlete should be standing whenever they're executing these lifts. So we're going to assess the hip in 3 different positions. The first position is going to be supine, or the patient or client laying on their back. The next is going to be flipped over in their stomach, and then we're going to be into quadruped on the ground. So what we'll do is my head will be out of the camera here just for the sake of the actual assessment. So the first thing I'll do is we'll assess Sebastian's left hip here. So I'm going to take his legs, completely relax. We're actually going to go arms straight here because I don't want any tension in the body at all. You can actually have them kind of sit on their hands if that helps or anything like that. Completely relaxed there. So I'm going to take his leg, ankle and armpit, hand underneath the knee. I have total control here, okay? And so since it's a short stable, I'm going to take a pretty wide stance here. So my first thing to do is I just kind of shake here and make sure that he's completely relaxed, because if he's trying to guard anything, it's going to create too much unnecessary tone in the front. So the first thing I do is I take his leg and I come into hip flexion here. And so 2 things I'm looking for is their stiffness, and I'm looking at his face here. Go chin down a little bit more. Just relax in that position now. When I go here, does he wince in any discomfort? If I feel a block or any pain, anything. He just wince, but he's faking it right now. Also, I'll do back off and I'll do it again to see what is his opposite leg doing when I'm coming into hip flexion here. And so I actually start to get a little bit of block there. Is there any pain there? No? I get a little bit there, so it's not hard. If it's hard, then it's bone. You will not stretch that out, period. If it's soft, it might be a little soft tissue. It could be the capsule, could be some labrum. Doesn't necessarily mean that anything's torn. So I could come in here and check internal rotation. Is there any pain there? Nope. Okay. And so another thing I'm going to do here is I'm going to follow the rim of the acetabulum of the pelvis. So I come here and I just follow it around here. And if you notice, this is where I start to get some restriction for Sebastian here. But if I take it out here, I get a little bit more depth before I start hitting anything. Is there any discomfort there? Nope. Okay. So it looks like right now this might be an optimal placement for his feet and or thigh path for the squat and maybe even the deadlift. We'll see. So I can also come out here, start to go in extension here. Then I start to internally rotate the thigh and then bring it into flexion here. Is there any discomfort there? So you got a little pinch in there. So it might be a little bit more capsule or more psoas here. All right, so the second position that we're going to test the hip in is laying down on your stomach or prone. So what we're going to do here is this is going to give us a better window into actually what anatomy does the patient or the athlete have whenever we're looking at the actual femur, the head and neck coming up into the pelvis here. So what I'll do is we'll just start with Sebastian's left leg here. I'll bend his knee to 90 degrees. And I'm just going to kind of lightly have my hand on his pelvis to just kind of stabilize the pelvis and feel if whenever I hit those end ranges of motion when I'm testing internal, external rotation, if he starts to kind of kick his hip a little bit here. So the first thing I'm going to test here is internal rotation. So I'm going to take his foot and move it out here so the hip is actually rotating inward. And I start to hit a little tissue there. Is there any discomfort there? So no discomfort there, which is good here. And it doesn't feel like I'm hitting bone. You can definitely tell when you're hitting bone. It's a hard end stop as opposed to kind of like a little soft end feel. And so now I'm going to go into external rotation here. And I start to get a little bit of restriction there. So I'm not going to really force it there. Any discomfort there? So no discomfort there either. And so what I'll do is I'm going to compare that to the other leg. So I will go internal rotation. And same kind of end feel. Any discomfort there? No discomfort. It's kind of soft. And then I'm going to go into external rotation. And it seems like he has more external rotation on this hip compared to the left hip. And so what I can do to actually see if the orientation of the femur into the pelvis, whether it's anteverted or retroverted, if this was a right hip coming up here and this is the acetabulum of the pelvis, think anteverted, anterior towards you, means it's rotated this way. so that leaves more room for internal rotation. Retroverted means it's rotated back. Think retro, back in the day. So I rotated retroverted there. I don't have much more, I have less internal rotation than I do the ability to externally rotate because it leaves more room. So to identify that, we do Craig's test. So my opposite hand here, again, he's completely relaxed here. My opposite hand here goes in a greater trochanter, and I can either go, I start to oscillate between internal and external rotation, and I stop whenever I feel the greater trochanter be the most prominent against my hand. And from there, he's a little bit internally rotated, so a little bit slightly antiverted from vertical, totally normal. Let's check the other side. And oscillate here. And he actually, you feel it more here, he's actually a little bit more retroverted on this right side compared to the left side. Okay, so the third position we're going to evaluate the hips in is quadruped. And what we're going to do is we're going to do some quadruped rocking. So we're going to see really what foot placement or knee placement in this case here, since we're not really involved in the feet, is going to be best for Sebastian to maintain a good position in the lumbar spine here. And so what we'll do is, is it okay if I pull your shirt up? It's right here. So I'll pull his shirt up here, and so just to kind of give you, actually I just have them relax in this position here to see what they do. And so he relaxes in the upper body here. Push me away. Good, and hold that right there. And when he pushes me away, you can kind of see arches here a little bit. Just kind of relax there. So what I want to do here is I want you just to start rock your butt back here. And come on up here. And so you can tell that Sebastian's either been coached or he is a clinician. So he actually, when he starts to rock, he actually starts the anterior tilt, which will keep his spine into a position here. And so his erectors actually turn on. So there's a little bit of compensation there. Normally what we'll see is when we start to rock is we'll fold over there and we'll go to lumbar flexion. This is an energy leak. You're not getting any performance out of this. Okay? Some come up. Let's go knees closer together. So now we're actually bringing the knees closer together here. So we're theoretically creating less room for the hip to go into hip flexion. So there you go. It's there. And he already started the break. And you can kind of tell that he's not as deep as he was before. Let's go knees super wide here. Excessively wide. Okay, so it's really wide. And let's go ahead and rock back there. And come on up. And so that, obviously, way more depth. But was that comfortable? That was comfortable. So go ahead and tighten up a little bit more. Tighten your knees up. Okay, good. What was more comfortable for you?
Deep, wider.
Wider. So Sebastian's really liking that wide stance. Do you like to squat with your legs within a wider thigh path?
Yep.
Okay. And that doesn't necessarily mean that he's going to have his feet super wide. He might have his feet slightly wider than shoulder, but his thigh path is going to be the determinant to clear room in the hip. Good. And come out. And so what you also do too is relax the low back here. You can kind of create a little intra-abdominal pressure or a brace. So give me a little bit more tension. Good. And so when he does it, you can kind of see some compensations. He starts to flex the spine. So I don't want to flex the spine. Relax here. Just give me some tension there. That's it. Hold that there. Keep that brace and start to rock back. Right there. Good. And this looks a lot better even whenever he keeps that brace. Coaches, want more hip tips? Click the link below for more assessment and power.